Hi, everybody. It's Nicole. I'm super happy to have you all here. We are joined by Linda Buck today with the WIC program. She's going to be talking to us about WIC and what they provide in our community. Of course, I've asked for permission to record this. So if you are watching the recording later on, please make sure to enter this in Optima. If you're here live during the actual meeting, I will be entering this in Optima for you, so you don't have to worry about that. And without further ado, I'm going to hand it over to Linda. If you want to just tell us a little bit about yourself and then get started with your program.
Okay, thank you. My name is Linda. I have a master's in education. I'm a registered and licensed dietitian. I've been with WIC since 1989. I retired from the Department of State Health Services as a WIC director. And then in October of 2012, I became a program supervisor for the City of Laredo Health Department. Now, the clinics that I oversee are Kingsville, Falfurrias, and Alice. We also have satellite clinics in Hebronville, Freer, San Diego, and George West. And our main headquarters is in Laredo. And my position here is program supervisor and high-risk nutritionist, dietitian. Okay, so basically what I have up here is just the different logos that Texas WIC has. Right up here in this area is just WIC is Growing Healthy Families. This is the official Texas WIC logo, but they recently changed it to this teal color right up here. This pink label here is some of the WIC foods, which I will explain later. Some of the WIC foods that participants have a choice of. Some must be WIC approved items. So basically what that means is it's the store's declared least expensive item. Okay, and I'll go over that some more. Right over here, my Texas WIC. Texas WIC developed an app for the participants, and in the app they can see their shopping list. They can take their classes, their nutrition classes, so they can get credit for that. And there's recipes, there's live classes they can join. I mean, it's just a wealth of information in that app, and I'll touch on that in a little bit. Okay, so okay. Now, at the end of this presentation, attendees will be able to define WIC, identify 2 eligibility requirements, name 3 services WIC provides, describe 3 health outcomes. Okay, so these are the questions that I'm going to be answering. What is WIC's history? How is WIC funded? Who can participate in the WIC program? What are WIC health outcomes? What are WIC approved foods? And then I will give you an overview of Texas WIC. Okay, WIC, the Special Supplemental Nutrition Program for Women, Infants, and Children, popularly, I can't talk today, known as WIC, is a nutrition program for pregnant, breastfeeding women and families with children younger than 5. Now, we do see a lot of single dads coming in. We see grandparents coming in. We see foster families coming in to the program. So it's we have a wide variety of participants. Okay. Okay. WIC is a federally funded nutrition program for women, infants, and children. WIC provides the following at no cost: healthy foods, nutrition education, and counseling, breastfeeding support, and referrals for healthcare and community services. I know this is not the nicest picture, but in 1960, various studies identified hunger as a major problem in this country. Physicians described young women, often pregnant, in their clinics with various ailments caused by lack of food. They saw a lot of malnutrition. They saw a lot of children with rickets, which is a vitamin D deficiency, lack of folic acid, poor health. They didn't have the means to see a healthcare provider as well. So this is just to give you a little history. So it was in 1960 that's when they started their research. Okay. Okay, now in December of 1969, the White House Conference on Food, Nutrition, and Health focused on the problem of malnutrition, hunger, and hunger due to poverty. Conference recommendations called for special attention to be given to the nutritional needs of low-income pregnant women and preschool children. Now, President Nixon did also, he was involved in this coalition with the Food, Nutrition, and Health Program. Now, there's a difference between the WIC program and the SNAP program. The WIC program provides supplemental foods, okay, and the supplemental foods, they're specific. They have protein, they are high in fiber, they're rich in vitamins and minerals, and also we provide nutrition education. And I'm not, the SNAP program is an awesome program, and I think that they also have dietitians that review how to make healthy food choices and so forth, okay. Okay, in 1972, WIC was piloted as a supplemental food program aimed at improving the health of pregnant mothers, infants, and children in response to growing concern over malnutrition among many poverty-stricken mothers and young children. In 1974, the first WIC site opened in Kentucky in January. Now in Texas, the very first, in Texas, in 1972, WIC piloted the supplemental food program. But in 1975 in Texas, WIC was established and permanent, okay. Now, 1974, the first WIC site, I just reviewed that, opened in Kentucky in January. 1974, WIC was operating in 45 states. Now, all states are have WIC programs in their states. In 1975, WIC was established as a permanent program by the legislation. Also in 1975, eligibility was extended to non-breastfeeding women up to 6 months postpartum and children up to age 5. WIC had initially provided supplemental foods to children up to age 4, but now it's been moved to 5, and there is talk that they want to extend it to 6 years of age, what would be great, and to breastfeeding postpartum mothers. Okay. Okay, now in 1978, legislation introduced new elements into the program. As I mentioned before, nutrition education must be provided. The supplemental food should contain nutrients found lacking in the target high-risk target population and have relatively low levels of sugar, salt, and fat. So before the WIC or the United States Department of Agriculture, USDA, before they select the food, the foods that they do select must be low in fat, low in sugar, and low in sodium. And then I'm going to go over some other things that are in our WIC foods that are awesome. States needed to coordinate referrals to social services as well, including immunizations, alcohol and drug abuse prevention, child abuse counseling, and family planning. So for example, I'm going to give you an example. If we have a pregnant participant come into the office and she's between the ages of 16 and below, we are mandated to submit a rider to the state agency. Okay. If we have a 13-year-old or younger, whenever we enter the information into the system, it automatically does the referral for us. Okay. Let's see. In 1992, WIC introduced an enhanced food package for exclusively breastfeeding mothers to further promote breastfeeding. So basically what this is state WIC wants to not only increase the number of pregnant moms to breastfeed, but they want also for them to continue to breastfeed. So we're working on retention in our breastfeeding rates as well. And there's a lot of information and things that the state is doing to help with that. Okay, now in 1997, the USDA implemented Loving Support Makes Breastfeeding Work, which is a campaign to increase breastfeeding rates among WIC mothers and improve public support of breastfeeding. So here in the state of Texas, they did pass a bill that gives a breastfeeding mom the right to nurse anywhere in public. Okay. And then also a lot of employers, companies, they're encouraged to have a designated area for their employees to nurse, okay, and a place to store their breast milk. Because many times before this bill passed, our breastfeeding moms would express their breast milk in the restroom. Now, I know that most of us wouldn't want to have our lunch in the restroom. So think about a mom nursing her baby. I mean, not her baby, but expressing her breast milk. In 2004, the Breastfeeding Peer Counselor initiative was launched. So basically, these are women with breastfeeding experience and training. Often they are past WIC participants. They became counselors to support other women learning to breastfeed, and this has been a huge success. So I know when this started, we looked at all of our breastfeeding moms, and then we narrowed it down to exclusively breastfeeding women, and we advertised to see, that we were looking for breastfeeding peer counselors and what the guidelines were. And we found that this was very, very successful because it's peer to peer. It's, mom to mom. And so today we still have this. We even have now, not in our clinics, but in a lot of other sites, they do have the Peer Dad, okay, program as well. Okay, in 2009, based on the Institute of Medicine recommendations, USDA introduced a new food package with foods consistent with the dietary guidelines for American and established dietary recommendations for infants and children over 2 years of age. So before, I don't know how long it's been, but before, WIC did not provide fruits. They did not provide vegetables. We didn't provide culturally sensitive food packages. So it was just basically the milk, cheese, cereal, juice, and so forth. And then I will be going over the food package in detail, okay, in a video. So let's see. So mothers who exclusively breastfed receive more healthy foods with the enhanced WIC food package. And this is only for exclusively breastfeeding moms, because if they're exclusively breastfeeding, they're not receiving any supplemental formula. So this is a way to keep the mom, to help with the retention. So they receive like and I'll go over the food packages as well. So we have partially breastfeeding moms. We have some moms that are doing some breastfeeding, and then we have exclusively breastfeeding moms. Then we have pregnant, postpartum, well, I mentioned the postpartum, and children and infants. Everyone's food package is tailored to their specific need, okay? Am I going too fast? Okay, great. How is WIC funded? Well, WIC, first of all, is a public health nutrition program under the jurisdiction of the United States Department of Agriculture, USDA. It is a domestic discretionary program funded annually through the U.S. Senate and House Appropriations Committee. The USDA Food and Nutrition Service, known as, FNS, drafts the WIC's annual budget proposed for the federal fiscal year. And our fiscal year starts in October the 1st, and it ends on September 30th. Through the funding process, Congress determines the level of funding that the program will receive each year. Once the appropriation passes Congress and is signed into law, these grants are provided to each state and administered at the local level by county and city health centers or private nonprofits. So, okay, so the USDA receives the funds. They divide them and send the funds to all the states. So like, I'm just going to go over Texas WIC. So Texas WIC, they have a funding formula. They have a base rate, and it used to be like $10 per participant. And then the formula included whether it was a rural agency or it was a metropolitan agency. So that and then they looked at the income in that geographical area, and they looked at the schools. It was they had different. The formula has more. So what they do, they start with the base rate, and then they add or subtract depending on the demographics of that agency. And then that's how the clinics or the agencies receive their funds. Now, we as clinics and as agencies, we have to earn the money that was appropriated to us, okay? So for example, in Texas, there's let's see, where are my notes? There is 1,900 local agencies, and each local agency covers a certain area. Okay, like City of Laredo, they cover Laredo, and then they cover us, the outer counties. So a certain amount of funds is provided to the City of Laredo. They have a contract that stipulates everything that needs to be done. Okay, and then what we do is for every participant that we serve and we issue benefits, that generates money, okay, to pay for the money that was given to the agency to provide services. Any questions on that? I know that's a little confusing. Okay.
I do have one question though.
Sure.
As far as the funding that comes through, if it's not all utilized, does it have to go back, or do you guys work super hard to like utilize all that funding?
The money that is not utilized at the local agency level, that money will go back to the state.
Okay,
Yes.
so you are trying to spin.
Yes, yes. And there, you know, of course, in the budget, there's a bucket for, you know, so many different things, for salaries, for rent, and, you know, all these different areas. And then there's operational costs. So
do you guys
if there's,
do you do any private fundraising or anything like that, or it's all state and federal funded?
it's all state federally funded. Yes.
Cool, thank you.
You're welcome. Good question. Okay, so WIC is for low-income pregnant and postpartum women, infants, and children up to age 5 who are at nutritional risk. So low-income applicants must have income at or below 185% of the U.S. poverty income guideline, or be enrolled in TANF, SNAP, or Medicaid. So we have, if you're a participant and you have TANF, SNAP, or Medicaid, that automatically qualifies them by income, for income, okay? But we also have, they don't have to be on those programs. For those who do not participate in those gateway programs, we can go by their income, okay? And I'll show you the list of the income guidelines in a little bit. Okay.
So just to clarify, individuals may utilize SNAP benefits, TANF benefits, and WIC benefits at the same time.
Yes, yes. Very good. I'm glad you asked that, because a lot of participants feel, well, if I participate in WIC, I'm not going to be able to get SNAP or be on Medicaid or so forth. And no, they're separate. It's just for them to get onto WIC. Okay. So some nutritional risk. Applicants are screened by health professionals for medically based risks such as history of pregnancy complications or poor pregnancy outcomes. Some pregnancy complications could be that maybe they had gestational diabetes during their pregnancy, or they had hypertension, or they gave birth to a prematurely birth, or they gave birth to a baby that was 9 pounds or more. Those are nutritional risk conditions, okay? But medically based risk conditions such as anemia, underweight, smoking, maternal age, if they're very young, or also over a certain age, history of breastfeeding complications or poor pregnancy outcomes. Second, diet-based risk risks such as not consuming the U.S. dietary guidelines recommendations. Okay. Now, before, since I've been with WIC since 1989, we used to do diet recalls to see what they were deficient in. So, but now USDA says everyone is at nutritional risk based on the dietary guidelines. Okay, so we do have risk codes that if they don't have any other risk code, we assign that general risk that they're not meeting the dietary guidelines. Okay, now what are the WIC health outcomes? WIC has been very instrumental in in reducing premature births, reducing low and very low weight babies, reducing fetal and infant deaths, reduce the incidence of low income anemia. Low iron anemia, increase access to perinatal or prenatal care early in pregnancy. So our goal, and it's one of our performance measures, our goal is to get pregnant mamas into WIC within their first trimester, because that helps with them having a healthy pregnancy outcome. Increase pregnant women's consumption of key nutrients such as iron, protein, calcium, and vitamin A and C. Also is instrumental in increasing immunization rates, improves the quality of their diet, increases access to regular health care. Okay. Okay, so here we're switching to Texas WIC. The vision of Texas WIC is to inspire all Texas families to live healthy lives. And our mission is to improve the health of low-income women, infants, and children up to age 5 who are at nutritional risk by providing nutritious foods to supplement their diets, information on healthy eating, and referrals to healthcare services. WIC is making a positive difference in the lives of the people that we serve. I can't read the bottom, but it's basically what I mentioned it on the top. And here it says here, there's no limit on how many people can participate in WIC. Our community always has room for more. We often have moms that say, well, you know, I really don't need WIC right now. I'd rather give it to someone who really, really needs it. Well, and we tell them, no, they help us. The more participants that we serve, it also helps our program, like you said earlier, so we don't have to send any money back to the state agency. Okay, so when participants are first certified for the WIC program, we provide personalized nutrition education. And when a nutritionist, because in the clinics, we have regular degreed nutritionists, and then I'm the high-risk dietitian, and I provide high-risk counseling for all the clinics that I mentioned earlier. The nutritionist, once they identify a high-risk condition, when they're certifying a participant, they will refer them to me. We provide breastfeeding support through peer counselors, like we mentioned earlier, through IBCLCs, And our agency does have a certified lactation consultant. We also provide, we've all been trained on breastfeeding. So we do provide, but if it's at a level where it probably needs to go further, we refer to an IBCLC. WIC, we do encourage our moms to apply for a WIC electric breast pump through their healthcare providers. But if for some reason they're not able to obtain an electric pump through their providers, we do have them here at the WIC office. We have hospital grade breastfeeding pumps, and those we issue them. They sign a contract, and then they have to bring it back to the clinic at an X amount of time. If they still need it for a longer period of time, we just update the contract. So, and also for moms who have been on WIC for exclusively on breastfeeding and after 3, 4, 5 months, when they bring the hospital grade pump in, we provide them with a pump that they could keep on their own, and it's electric as well. Because the hospital grade pumps are they're about $500. So, but we do provide them with some that they can keep.
I have a question, Linda.
Yes.
I know that we've been talking a lot about breastfeeding moms and breastfeeding support, but I wonder if clients come in that do not have a desire to breast pump, is that accepted? Is breastfeeding pushed?
We encourage, and we provide them with all the information, and then they decide what they're going to do. We have moms that do both. We have moms that supplement and then they breastfeed. Okay, but we do not, I mean, if a participant does not want to breastfeed, we're okay. We're not.
Another question regarding that, is exclusively pumping and breastfeeding synonymous within the program? Like if a mom doesn't want to take the child to breast but wants to exclusively pump, is that also encouraged or supported?
Yes.
Cool.
We've had many moms that have just pumped, and some have pumped all the way until the baby is a year of age. So we have a lot of different scenarios, but we're very supportive here. We're not pushing, we're encouraging. And okay. So we provide healthy foods and referrals to other healthcare services, which I've already mentioned. Okay, you're going to see I repeat myself in certain slides. Okay. Now, this is what we provide to our at WIC when they first are certified for the program. We provide them with this handout. What did I do with it? We provide them with this handout right here. Okay. And in here, it explains everything about the program. So you had your first WIC appointment and qualified for the program. What comes next? Okay, so let me backtrack a little bit. At the initial certification, say we have a pregnant mom and we certified her, she's on the program until she delivers. Once she delivers, we have to update all of the information again to put the baby on WIC, okay? And we have to see proof of ID, proof of income, or proof of a gateway program. We also need a a picture of something with their address on it, okay, to show that they do live here. And then we certify them for WIC. Now, children, infants are on until they're a year of age. Then we certify them as children, and they are eligible until they're 5 years of age. Okay. Our postpartum moms, they're on for 6 months, but their babies are on for a year. Our children, when we certify the children, they're on for a whole year. And then at the end of the year, we'll certify them again, basically, which is updating their information. Okay, we also provide information for support groups, like breastfeeding support groups for our moms. And of course, we encourage our moms to find other resources. We provide them with referral lists. If there is a support group, we provide them with that information. Okay. Okay, now nutrition education is very big in the WIC program. Nutrition education is an integral part of the WIC program through online classes, group education, personalized counseling, and a variety of educational opportunities. WIC supports Texas families in making healthy choices to promote positive outcomes. Okay, so pre-COVID, before COVID came along, we had group classes. Participants would come in and we would have, we would break up the classes. We had classes for women who are expecting. We had classes for breastfeeding moms. We had classes for mothers who have children, toddlers. And then we had general classes. Now, that was pre-COVID. Post-COVID, we're not conducting any classes. They have a choice between maybe meeting with a nutritionist one-on-one. We do have self-paced lessons that they can complete here at the clinic. And the majority of our participants, and I want to say at least 90% of our participants, are completing their classes online. And they love it because they can do it at their pace. They only need to choose one so they can get that nutrition education credit so we can issue their benefits. And I know we have some others, sometimes they have trouble accessing the website to complete their online class, and that's fine. We have very short classes here, self-paced classes as well. Okay, let me change this. Okay, so we provide breastfeeding help and information. Now, Texas WIC strives to improve the health and wellness being of Texas and WIC families by educating, empowering, and supporting women to breastfeed. And these are some places that we, resources rather, that we provide to our moms, like breastmilkcounts.com. That is an excellent website for moms. It provides a wealth of information. There's also mother-friendly work sites in many different clinics. We acknowledge National Breastfeeding Month, and we provide activities. We acknowledge our breastfeeding moms. And in August, that's when we have National Breastfeeding Month. We also have African American breastfeeding promotions, and there is also something called the Texas 10-Step Program, where our lactation consultants or IBCLCs work with the hospitals on becoming a 10-step program, which and all that has to do with breastfeeding. We also provide our moms with a Texas lactation support centers and hotline numbers. So if it's during the weekend and they have questions or we're not available, they always have someone to contact. Okay. What are WIC approved foods? And I think I'm going to go over this in the, let me see if I can get to the videos. Okay, to give you all a break of the slides. Let me exit. Let me stop.
Linda, I wanted to let you know, if you're going to show a video, when you click your share screen, on the bottom left-hand corner, there's a box that says share audio. Make sure you click that so we're able to hear the film.
Okay, thank you.
You're welcome.
Okay. Share screen. Share sound. And share. Okay. Okay, so this is the TexasWIC.org, and this is where participants can come in. And we're going to start about at the first one. And this just tells them about WIC. And then also there's testimonials about moms, from moms. And basically, as a WIC client, you will get healthy foods, one-to-one counseling with nutritionists, recipes and cooking demonstrations, nutrition classes, and breastfeeding support. There's also WIC foods what you can buy. Oh my goodness. Okay. So, and they'll click on those things. So right here, I'm going to go to new families. Okay. So if they're brand new to the program, they can click here and we welcome them and thank them. And then it gives all the information that I reviewed earlier. So basically, infants and children stay on WIC until they're 5. Women who are pregnant receive WIC food benefits until the end of their pregnancy. Women who are fully or partially breastfeeding receive WIC food benefits until their baby is a year of age. Women who are breastfeeding some or only formula feeding receive WIC food benefits until their baby is 6 months postpartum, 6 months old. And so basically, if they come in today, we'll issue benefits for 3 months. So we don't have to see them until 3 months. So on their next visit, they will complete an online class of their choice, or they can come in and complete a self-paced lesson. So when they come in, they'll show us on their phone the snapshot of the class that they took, and we'll enter that into the computer and issue their benefits. So we issue for every 3 months. Now, if there's a change, a formula, the doctor changed the formula, then they'll come in. They don't have to wait the 3 months, and we'll make the change right then and there.
Are women and children required to see the nutritionist at all during this time?
Pre-COVID, they did see the nutritionist all the time, or me. I'm the high risk. If they had a high risk condition, I would see them. Now, for me, they don't have to see me. It's an option for them. Many times, a lot of them are already being followed up by an outside RD. Okay, so that's fine. And with the nutritionist, they'll see the nutritionist because the nutritionist will go over this was pre-COVID, we'll go over the nutritional risks that were identified, and will give the mom some information on how they can help resolve that risk condition. Okay. And we always involve the moms. We don't choose the goal for them. The mothers will choose the goal. Okay. Let's see. Okay, resources for new WIC families. It has their guide to helpful programs and services. Your Texas WIC. Let me see. Let me click on that. Let's see what that is. This is the book that I was talking about, the little pamphlet that our first time participants receive. Okay, and it has, these are all the topics that they go over. Oh, beautiful pictures. Okay, so we'll go back. Trying to figure out how to go back here. Okay. Okay, so this, I'm going to go ahead and show you this. This is what our participants, we encourage them to see this video. It's shopping for WIC foods. And then for those, what was that? Okay, so let me go ahead and play that. Hopefully, let me know if you can.
Welcome to Texas WIC. Whether you're new to WIC or already a part of the WIC family, these videos will help you find your WIC foods at the store. This series of short videos is divided into clips that show the types of foods that you will get from WIC each month. Shopping can be stressful, but follow these steps to make WIC shopping a little bit easier. Your monthly WIC benefits include foods to keep your growing family healthy. Before you go to the store, look over your WIC shopping list that you got from the WIC office. You'll see how much of each food you and your family will get every month. Bring your WIC shopping list to the store when you shop for your WIC foods. If you don't have a copy of your shopping list, you can get your benefit balance at the grocery store. Just ask a cashier for your WIC balance before you start shopping. They'll tell you when to put your WIC card in the card reader and enter your PIN, like at checkout. You can also download the My Texas WIC mobile shopping app to view your benefits, but it can take up to 5 days for your benefit balance to update on the app. Next, make sure you have your WIC shopping guide. Or use the shopping app and go to the shopping guide section. You'll need a shopping guide to help you choose the brands and sizes that match your benefits. And of course, you'll need your Texas WIC card to pay for your WIC foods at checkout. With your current shopping list, the WIC shopping guide, or the shopping app and your Texas WIC card, you're ready to go. Remember these tips as you shop. Pay close attention to package sizes. The size must match your benefits and what is listed in the shopping guide. Not all stores carry the same brands. Your shopping guide tells you if you can choose any brand, specific brands, or brands with a pink WIC sticker. You can also use the shopping app at the store to scan items as you shop. The app will tell you if an item is WIC approved or not. Just make sure you have the benefits for the item before you check out. If you accidentally pick up the wrong size or brand, it will not scan as WIC approved at checkout, and you won't be able to pay for it with your WIC card. You will have to pay for the item with another form of payment like cash or SNAP, or put it back. When you are done checking out, you will get 3 receipts or 1 long receipt that shows your WIC purchases. Your WIC benefits do not roll over from month to month, so make sure you get all of your WIC foods by the end of each month. Shopping for WIC milk can be a little confusing, so follow these 3 steps. Step number 1, check your WIC shopping list to see what kind of milk you can buy and how much. Women and children 2 to 5 years old get skim or low-fat milk. 1-year-old children get whole milk. Milk is listed by the gallon, but you can get half gallons too. Step number 2, check the shopping guide and see that milk is a pink sticker item. Step number 3, look for the pink WIC approved item sticker on the shelf. There are pink stickers on different types of milk at the store, but you need to pick the one that matches your WIC shopping list. The most common mistake is when someone grabs milk that has a pink sticker, but it's the wrong type of milk. For example, whole milk and 1% milk both have pink stickers. If your WIC shopping list says whole milk and you grab 1%, the 1% milk will not scan as WIC approved. WIC can provide other types of milk. Let your WIC staff person know if you need them. Yogurt is on your WIC shopping list in quarts. Usually, you will have a choice between another quart of milk or a quart of yogurt. Women and children 2 to 5 years old get non-fat or low-fat yogurt. 1-year-old children get whole milk yogurt. When you shop for yogurt, pay close attention to brands. There are certain brands that are WIC approved. Use the shopping guide or the My Texas WIC mobile shopping app to see which brands are WIC approved. If you're not sure which yogurt is WIC approved, you can scan it with the shopping app. It will tell you if it's WIC approved. If the yogurt scans as WIC approved, you still need to have benefits for it. So remember to check your WIC shopping list or benefit balance. You've got the right brand, the right fat content. Now, just be sure that it's the right size, 32 ounces or 1 quart. That's the big tub. Let's recap. Shop for milk by looking for the pink sticker. Shop for yogurt by brand. Match the fat content for milk and yogurt with your WIC shopping list or benefit balance. WIC can provide these other types of milk too. To get one of these milks, just ask your WIC office. WIC staff can put one of these on your WIC shopping list so you can buy it at the store with your WIC card. If you choose soy milk, tofu, or kosher milk, you will shop by brand. Use the shopping guide or the My Texas WIC mobile shopping app to find out which brands and sizes are WIC approved. If you're shopping for lactose-free, evaporated, or dry powdered milk, check your WIC shopping list first to see which fat content you can get. Women and children 2 to 5 years old get fat-free or low-fat milk. 1-year-old children get whole milk. For lactose-free, evaporated, or dry powdered milk, you can choose any brand. But make sure you pick the fat content that matches your WIC shopping list so it scans as WIC approved at checkout. Look for these sizes at the store. Some varieties, like chocolate flavored or added protein, are not WIC approved. If you're not sure which milk is WIC approved, you can scan it with the shopping app. If it scans as WIC approved on the shopping app, you still need to have benefits for it. So remember to check your WIC shopping list or benefit balance. If you're shopping for soy or lactose-free milk, this part can be a little tricky. Soy milk and lactose-free milk are on your shopping list in gallons, but you can only buy half-gallon sized containers. 2 half gallons are equal to 1 gallon. So if you have 1.5 gallons left for the month, that means you can get 3 half-gallon sized containers. Remember, you can only buy these other types of milk if they are on your WIC shopping list. So let the staff at your WIC office know if you are interested. cheese is on your WIC shopping list in pounds. To find WIC-approved cheese, look for the pink WIC sticker. You can choose from blocks of cheese, sliced cheese that is not individually wrapped, or string cheese. WIC-approved cheeses come in 1 pound and 2 pound packages. The types of cheese that are WIC approved are listed in the shopping guide or on the My Texas WIC mobile shopping app. Not every store will have every type of cheese. These types of cheese are not approved. Eggs are on your WIC shopping list in dozen-sized cartons. That's 12 eggs. You can choose any brand of eggs in white shells. The eggs can be any size, like extra large or jumbo, but they have to be in a carton that holds 12 eggs. Organic, brown, free-range, or pastured raised eggs are not WIC approved. Whole grains, including bread, tortilla, rice, pasta, and oatmeal, are on your WIC shopping list in pounds. That means that for each pound you get, you can choose a 1 pound item, not 1 pound of each item. If you and your family get 2 or more pounds of whole grains on your WIC shopping list per month, you can mix and match. For example, if you have 2 pounds listed, you can get a 1 pound loaf of bread and a 1 pound package of rice. Some food packages may say 1 pound and others may say 16 ounces, but don't get confused. 1 pound equals 16 ounces. If you are shopping for whole wheat bread, corn tortillas, or whole wheat tortillas, look for the pink WIC approved item sticker. With so many choices, the pink sticker can be hard to spot, so look carefully for it. If you are shopping for oatmeal or whole wheat pasta, you must choose from certain brands. Use the shopping guide or the My Texas WIC mobile shopping app to find the WIC approved brands. And if you are shopping for brown rice, choose any brand of regular rice or instant brown rice in a 14 to 16 ounce package. Cereal is on your WIC shopping list in ounces. You can choose different brands and sizes that add up to the amount on your shopping list. You'll shop for breakfast cereal by brand and size. Use the shopping guide or the My Texas WIC mobile shopping app to find out which brands and sizes are WIC approved. Sometimes a WIC approved brand is available in a size that is not WIC approved. Make sure you check the brand and size. Let's say your shopping list shows you can get 36 ounces of cereal. You can choose a combination of sizes, like 2 18-ounce boxes or 3 12-ounce boxes. To get the most of your benefits, try not to choose an 18-ounce box and a 12-ounce box. You will have 6 ounces left over that you can't use. Fruits and vegetables are on your WIC shopping list as a dollar amount. $11 value means that you can buy $11 worth of fruits and vegetables. You can buy fresh, frozen, or canned fruits and vegetables, including organic. Many of the items in the fresh produce department are WIC approved. You can choose from a wide variety of frozen fruits and vegetables. Many cans, jars, and plastic containers of fruits and vegetables are also WIC approved. And you don't have to choose just one kind. You can mix and match and get some fresh, some frozen, and some canned items. There are some items that you cannot buy. like fresh herbs or canned or frozen fruit with added sugar. Check the shopping guide or the My Texas WIC mobile shopping app for all the details. Check labels carefully to avoid grabbing an item that is not WIC approved. You can also use the scan feature in the shopping app to see if something is WIC approved. And if you go over your dollar amount for fruits and vegetables, you can pay the difference with cash, credit, debit, or SNAP benefits. Is on your shopping list in the size containers you can get and the number of containers you get for the month. When you shop for juice, the first thing you need to do is check what size container is on your shopping list. Women get 48 hours.
The first thing I was thinking, Linda, $9 for fruits and vegetables nowadays. Oh my goodness.
I know it's not enough. And there, let me see if I can, stop sharing.
Yeah, we're off the share. I can see you.
Okay. Okay. Yes. Recently, since the summer, maybe started in May, there was an increase in the amount of fruits and vegetables that participants could receive. Trying to enlarge this. Let's see. There we go. And so pregnant women received a certain dollar amount, and then children received a certain dollar amount. So it did go up. We're hoping that it continues after September because of the cost of foods. There was one more.
Marianne, I see your hand up. Did you have a question?
Yes, but I'll just wait until when she finished finding that answer for you.
Okay.
Okay. There was one more thing, if we had time, I wanted to show you, but I don't see it.
What's up with that dollar amount?
Pardon me?
Who comes up with that dollar amount per person?
The USDA, and then it trickles down to the states. Good question. Okay, I lost my Texas WIC.
Marianne, you can ask your question if you'd like while she's looking for that.
Yeah, because I gotta go as well. The question I have, maybe I missed that part, but all the discussions I've been hearing talking about the mothers and this and that, but for CASA, we have grandparents and foster parents taking care of babies.
Yes, yes, we do. And we do see a lot of grandparents coming in with their grandchildren. We have a lot of single dads bringing in their children. We even have aunts and uncles that come into the WIC program. Yes. So
I just, because all the stuff that I heard or I understood related to the moms, so I was wondering if all we had to do was to take out mom and put in the caregiver and then use the same procedure.
Yes, we do. What we do is we need a signed letter. And then sometimes, like if it's foster or grandparents, we do have some forms that they need to bring in to show us that proof that they are the guardian of their grandchildren, or you know, and then with the foster parents, they just show us the placement letter. So did that answer your question?
Kind of sort of a kind of sort of a meaning that I'll follow up with my supervisor, and I'm sure you'll give us documentation and we can look through it, because I do have an actual case with 1, 2, 3, 4 4 kids that would benefit from this. So I just need to check on it. I know there was talk about it, especially when we're having the baby food shortage and problems and so on and so forth. But I wanted to know when the 6-year-old thing would come in as well, because one child is actually 5 now.
Yes, that is being worked on with the National WIC Association and Congress.
So when you get to 5, can you still go on until you get to 6, or it cuts off at 5?
It cuts off at 5, but they are working on extending it until they're 6 years of age.
Okay, so that
but-
5-year-old wouldn't benefit, but the others could benefit. Okay.
Yes.
Thank you.
Yes.
Those are my questions.
Okay. Thank you for the questions. Okay, so any other questions, ladies?
That
No,
was,
thank you. It was good information.
yeah, for
Great.
sure. It was a great program. I feel like I know a lot more about the program now. And I didn't even know that, like Marion was asking regarding like foster parents, I didn't even know that they could seek those services. So that's really valuable for us.
Yes, yes.
Awesome.
We've had foster parents with infants with special needs, you know, and we provide them with the formula that is specifically needed for the infant, because we have a contract with Similac and we provide Similac formula. But starting in October, we're going to be moving into the Enfamil products. And then also something that's really exciting. This month, we have been issuing like a WIC credit card to mothers with infants on formula because of the recall. So for those who are not able to find the formula that they need, they have that it's a $50 gift card to help them with that. Yes. So, and then I know during that formula recall and the shortage, we did work with the doctors and the participants to change the formula to meet the needs of the infants, because there's so many different types of formulas. So we did work around that. I know it was a challenge. It was a challenge.
I have one more question that just popped in. When it comes to wellness checkups for the children, does WIC monitor that, whether or not the children are receiving those wellness checkups?
Yes, for infants, we encourage that they have a midpoint checkup with their doctors. Before, we used to do the midpoint checkups. We would do the height and the weight and check their iron. But because of COVID, we're not, there's been a waiver, so we're not doing heights, weights, or the checking for iron.
Got it.
Mhm.
Awesome. Does anyone else have any more questions? Perfect. Well, I thank you, Linda, so very much for spending time with us today. I did record this video and I'll be sharing it with other volunteers so we can get the good information regarding the WIC program. So thank you so very much.
Thank you so much. And thank you for all the questions and for inviting me. There was so much more that I wanted to cover, but I know we're limited with time. But anytime you have questions, feel free to give me a call.
Will do. Thank you so much.
Okay. Thank you. Have a good
day, everyone.
Bye.
Bye.